this is Dr. Sattar from the YouTube channel Doctor to Help. Today is March 14th and we are going to talk about diabetes. On this video, we're going to talk about diabetic diet, diabetic complications, and need for doctor's visit and lab work and timing. All right, so let's start. Diabetic diet. We're all excited about learning that, right? I know. You are going to hate me probably after the end of this visit. Please don't. If it makes you feel any better, I just want to let you know I am pre-diabetic. My hemoglobin A1C is 5.7, so I am in the same group as you are and maybe a little bit ahead, that's all. All right, so first thing, a diabetic diet. A diabetic diet, person with diabetes cannot have any carbohydrate, zero carbohydrate. Is that true or false? Yeah, it's not a trick question. True or false? False. Diabetics don't need to throw away all the carbs. Body still needs carbohydrate, but they need to do a proportionate meal. So what is a proportionate meal? American Diabetic Association tells us to eat in proportionate meal. They don't want us to take large plates. They want us to do a half a plate, something like this. And when you take a plate like this, divide it in half. One half is going to be fruit and vegetables. On the other half, make another half. The top is going to be protein. And the lower half is going to be complex carbohydrates. Why complex? Complex carbohydrates take longer to break down rather than the simple carbohydrates like sugar. So these are found in starch containing food products. All right? So what amount do you want to have in a carbohydrate? Remember, I said 1/4 of half a plate, or the smallest cup, the amount of a smallest cup and no more. Okay? Don't hate me. I'm just a messenger. Okay? So the way you can establish this, if you are used to eating a lot of food, I don't want you to cut down all of a sudden. You want to do it gradually. All right, so because your body is already used to that, so you're going to be hungry and it's going to be a vicious cycle. You don't want to do that. You want to gradually adapt. And if you're sitting there and thinking, oh no, I don't have diabetes, are you sure? Remember, you have to have 90% destruction of beta cells before you have diabetes symptoms. So it is better that you check your annual labs and make sure you have a hemoglobin A1C there to check for blood sugar. Very important for everyone, especially if you have one family member who has diabetes. Remember, it is a genetic disease. All right, so back to food, diabetic diet. If you go to a store, what are you going to buy? I want you to go first to the green section, the colorful section. Go to the outer part of the store where all the fruits and vegetables are there. It's all fresh, right? What are you going to choose? Good ones that has fibers, right? What food items have good fibers? Think about broccoli, think about cabbage, think about cauliflower, think about artichokes, think about avocados. These are all rich in fiber, all right? And there's another good news. If you buy broccoli, cauliflower, or cabbage, they have their own ingredients in them. They have an inborn protection. They can defend against bugs. So not so much bug sprays are sprayed on them. So you don't need to buy them as organic. All right? So think of those things when you walk into a store. Go fill up the cart halfway with fruits and vegetables so you don't have space for those nasty snacks and simple carbohydrates. Those are bad for you, especially soda and chocolates, candy, all those things. Are you going to just throw them away? No. You need to look at the labels, look at the carbohydrates. You want to look at anything that's whole grain. When you buy food like rice, you want to buy brown rice. Brown rice, you want whole grain. What does whole grain mean, by the way? Whole grain means the whole plant is harvested and dried without any processing. That's called a whole grain. So you want to look at anything that has whole grain written on it. If they say unriched, that means it was processed. And a lot of states have a law that you have to, what they do in the processing is they take out the outer layer of that grain, which is the beneficial part. It has all the fibers, it has nutrients and minerals, the vitamins and minerals. When they take that off, we're losing them. So we don't want that. We want brown rice. We want whole grain like oats and barley. So when you're choosing them, if they're enriched, what they do, some of the states say that you have to give that minerals back and they enrich it, but it's never as good as the whole grain. So keep that in mind when you go to the store. Go for enriched. Protein, very important, have enough fish. If you have fish 1 to 4 times a week, study shows it increases your brain development, increases the density of your brain, and it keeps dementia away. It's very good for diabetes as well. So make sure you're eating enough fish. Red meat, you should not have more than 1 meal with red meat a day. All right? Because red meats are very increases inflammatory markers, which is bad for the body. It causes damage and it also causes cancer. So diabetic diet is very good in preventing cancers. So that's a plus, guys. So think about it. You're going to be ahead of those guys, right? Think about all the pain that's associated with cancer. You don't want that. And when you're making your snack for your child at school, please plan a snack for yourself, a diabetic snack. Because guess what? If you're not around, your child will not get that snack pack. There's nobody to prepare for him or her. This is very important. All right? If you're going to have meat, you want to try to go for the lean meat. You want to go for turkey, chicken. Those are better. So the worst one is pork and bacon. Again, please don't hate me. Pork, bacon, then there is beef, and then there is mutton, then there's chicken and turkey. That's the order that we need to go. All right? So next, we talked about food. Remember also fruits. We want to get the fruits that are good, that something that the skin is edible, like apple, pear. Those kind of fruits are very good for us. All right? So eat that food. Remember that we can have a glass of water, or we can also have 1% dairy milk. All right? In addition to that, I want to remind you about fiber. Fiber is very, very good for diabetic or anybody. Fiber maintains our body metabolism, maintains good gut health. What it does, it absorbs water, expands, give you early satiety. So what I would suggest is drink 2 glasses of water before you eat your meals. So when that water goes and combines with your fibers, it's going to expand, it's going to make you feel full, and you won't want to eat anymore. So it's good for that. It also increases peristalsis, so you will have better metabolism in your body and a good gut health. So fiber is very good. Make sure you're eating about 28 to 30 grams of fiber a day. Also, calorie count. Try to learn about calorie count. What food gives you how much calorie and how much are you burning by your own activity. Every person is different, right? Every person's metabolic rate is different. So you want to also check your blood sugar half an hour before every meal. And you also want to, initially you might even want to check it later after a meal, like about 2 hours later, and see which food is affecting your blood sugar in what way, and kind of work your own meal plans. All right? And another advice, I want all diabetics, if you can afford it, please see a nutritionist at least one time. They'll give you so many points to make a good healthy diet that it's going to be priceless. So anytime I see a new diabetic in the hospital, I put in a diabetic nutritional diet and consult for them to come and do the counseling so that they can kind of make them ready. Remember, carbohydrate is rice and also tortilla. All those things we want to cut down and make sure it's only quarter portion of your plate. All right? Very good. Next, I'm going to talk about complication. Diabetes, if you don't have it under control. In type 1, you need insulin no matter what. In type 2, there are things you can do. You can lose weight. You can decrease your inactive time, like doing more physical activity, and you can have a good healthy diet. If that doesn't work, I would say go for medication. But before you go for medication, make sure you go and exhaust all the other venues, right? So how are you going to diagnose diabetes? Diabetes is A1C from 5.7 to 6.4 is pre-diabetic. From 6.5 and above is diabetic. Now, our goal is to keep the hemoglobin A1C less than 6.5. If you can keep your hemoglobin less than 6.5, your risk of complication for diabetes and a non-diabetic person is the same. So yes, you can control your diabetes and you can prevent it from taking control over your life. You can control diabetes if you want to put your mind to it. All right? So it's not the end of the world. All right? So another thing is random blood glucose. If you do a random blood glucose, like anytime, like after a meal, if your blood sugar is more than 200, you're diabetic. If you are below 200 but above 126, that is pre-diabetic. If you do a glucose tolerance test and you find after 2 hours your blood sugar is 144 to 199, that's pre-diabetic. Above 200, you're diabetic. All right? So those are the 3 steps that we do. Also, when there's so much blood sugar running around in a diabetic patient's blood, it also goes and attaches to hemoglobin. And that's hemoglobin A1C is also measured for diabetes. And it gives you an idea about your blood sugar control for 3 months. Initially, I recommend everybody to check their blood sugar every 3 months. Check your blood sugar in hemoglobin A1C every 3 months. Check your blood finger stick 3 times a day, half an hour before you eat. Write it down, take it to your doctor to review. Until the blood sugar is under control, you need to see your doctor regularly. I would prefer every 3 months. You want to do your lipid panel every 6 months. You want to do an A1C every 3 months. And you absolutely want to do your annual lab. You should have an eye exam done also once a year. Why? One of the diabetic complications is diabetic retinopathy, and that can blind you. So you want to keep ahead of that. So a lot of type 2 diabetes are not diagnosed until sometimes they already have the complication. So sometimes we incidentally find them. They come to the hospital for an infection. We check their blood sugar and we find it sky high. And then we say, do you have diabetes? The patient says no. And then we do an A1C and then we know that yes, they have diabetes. So we give them the bad news. So yes, you have to be very alert. If you have one family member who has diabetes, there's a very good chance you can develop it. If you catch it when you're in the pre-diabetic level, you can do so many things to prevent diabetes. Why shouldn't you? Right? So let's talk about complication. From the eye, we already talked about diabetic retinopathy can lead to blindness. Diabetes can cause blood vessel damage, both in small, medium, and large. When it causes damage to the medium and large vessel, it can cause heart attack and stroke. On our feet and our hand, it can cause nerve damage and the blood vessel damage. It causes ulcer and it quickly turns into infection because diabetic patients do not have immunity to protect themselves from skin infection, from any kind of infection. They do not have the same immunity as a non-diabetic person. So because of nerve damage, they may not even feel small skin breaks in their feet. So it's very important when you go to your doctor's office, we are told a diabetic exam is not complete until you look at their feet. So you have to take off their shoes, take off their socks, and look at it. And I used to do that judiciously. So please, if you have an elderly member in your house who has diabetes, please regularly check their food. Make sure there's no skin break, there's no infection. If there's infection, it can quickly turn out of control, get septic, and you may lead to amputation if it's not under control and given antibiotic quickly. This is very important. in the kidneys, it can cause efferent and afferent arterial damage, and that can lead to nephrotic syndrome. And if this leads to kidney failure, what happens? We become dependent on dialysis. If we are on dialysis, imagine doing dialysis 3 times a week. You have to travel to a dialysis center, stay there for several hours. You feel crap before, you feel like a crap after, and you come home feeling miserable. So 3 times a week going to a dialysis center, you already lost 3 days of your time. You only have 4 more days, all right? So you don't want to go there. So do everything you can to prevent that stage, all right? So you can do it. Proportionate meals, exercise, medication, check your blood sugar regularly, address it, and feel free to contact me or any other doctor that you have, whoever it is. Ask them questions. You need to learn. You need to be on top of everything, all right? Just as a last reminder, in Dr. Says, that's where I work, you can do a whole annual lab test for $79 without insurance. That's even cheaper than when I had insurance. And the doctor's visit is anywhere between $25 to $39. Usual copay in my office was first visit $278, and second consequent visits were more than $100. So it is something that is reasonable. So that is not an excuse not to see a doctor and not to take care of your problems, your diabetic issues. So yes, Dr. Says is all over United States. Make an appointment, see a doctor, address any problems you have. If you need medication, you're running out of it, don't miss out your meds. Please, please don't. There, you don't need to dress up. You can just make a phone call, talk to a doctor, and get a prescription. There's so many telemedicine online. If you just Google search, it will show you. But as far as I know, ours is the cheapest. Teladoc, there is MD Tech, there's so many places. Just Google search. And my video that has how to save money on medical bills, that one has all the information on telemedicine. So have a look at it if you need to. GoodRx app, download it on your phone, and when you fill out your prescriptions, look at the coupon, click on it, and tell your pharmacy, please give me this price. And you can look at which pharmacy is giving you which price, so you can go to that pharmacy, all right? Good luck. You can beat diabetes. Diabetes does not have to rule you. You can rule diabetes. Trust me, all right? Thank you again for joining me today. Take care. I love you all. See you next time. Bye-bye.